The question here, have you or your family members ever experienced difficulty paying medical bills? And we would extend that then to the folks, the people that we are in contact with in our day-to-day work. And then second, what do you think policymakers can do to address this problem? So why don't we just take the first one first, and have we, or do we know, been in contact with people who are experiencing this firsthand?
I'll go. I experienced this firsthand with my family, and and looking at, we had health insurance. My parents had health insurance, and then my father was in an accident, and in the hospital for over a year with traumatic brain injury. So, what do? The solution was, at one time, my parents needed to get a divorce, so my dad would qualify. I can't believe I'm saying this on YouTube. Sorry. I'm healing. No, at another point in time, it was the hospital was going to. The hospital was going to kick him out. Done. Insurance is done paying for this. How can what can you do? So I don't know what the answer is, but a family who's going through something like that should not be put in that position. And so I don't think I have the answer, but it's something, and I have to say that, again, going back to the fortunate thing, we were very, very fortunate in the community, and that my parents lived in Tulsa, that we knew the people that were able to make it happen. And I always said, what about the people that don't know the people? So.
Well, and this just demonstrates that a single story is more powerful than 1,000 statistics. And that's one of the reasons why we're doing this, is to find those stories, to collect those stories, and to make sure that they're heard. It's going to drive the policy solutions forward. I wish that we did have a good answer for what do you do about that, but as the moderator, I have to keep my mouth shut and throw that out to the group. I mean, what solutions do you see for mitigating that medical debt? I mean, for people who reach their lifetime cap on health insurance or reach their annual cap on health insurance. I mean, what solutions are there for that? What can the government do?
Ultimately, the insurer of last resort. That when you're done with this, when your regular insurance runs out, if you have it, then you go into some kind of catastrophic fund that the government maintains, and I think the government's the only entity that can maintain that kind of risk. And maybe we all pay premiums in that, so that if we do have to draw on it, at least we pay something into it. I wonder also if there's something that you can do with the tax code, so that if you do get into this type of medical debt, this at least becomes tax deductible. I know that there are income levels and expense ratios and things like that for deductibility of medical bills, but it seems to me to be pretty unrealistic in a lot of cases. And maybe you take this debt, and I don't know how you justify it, and that gets written off. But it seems to me that on a catastrophic front, especially the kind of injury your father had, the only entity with the resources to affordably, well, I won't say affordably, to do it, is an entity like the federal government.
Because essentially we're looking at two issues when it comes to the affordability question. One is affordability for families, and the other is affordability for the country. I know that, for instance, on affordability for families, one of the things that we've looked at in the cancer community is a proposal that would waive those lifetime limits or those annual limits for persons with cancer. And I mean, that could be a model that we could apply to the health system at large. But again, that's more affordability for the person. I mean, we're looking at health costs in the U.S. that are flying out of control.
Running out everything.
So,
I don't know what the answer is, but we need to find where there is cost-saving opportunity. And it seems to me that those pockets of opportunity are looking at the process itself and streamlining it, the paperwork, the administration, applying technology to the process to take out costs that could then be used somewhere else. I just think about every time I go to the doctor and I fill out pages of information about my health history. And all of that should be technology applied to it so that we're reducing all of that paperwork.
Unfortunately, nobody's paid for that. I mean, that's the reason why doctors are the only industry in the US that doesn't have electronic records, that doesn't use a computer regularly, because no one pays them to do that. You know, they're paid on time and services, and the time that they're putting into instituting the medical records or taking a phone call, and you know, I've got allergies, my kids get sinus and ear infections all the time, we know what it is. Why do we have to go in and pay a copay to have them say, yep, they're infected, here's a prescription? Why can't we just call it in? Because he doesn't get paid for a telephone call.
You talk about a potential for an infrastructure project, you know, upgrading this healthcare system so that no matter where you go, they put your number in and they've got your history there. Man, that could do a lot of programmers deployed hopefully in the US.
But there's
That
such
would help
fear,
with the-
I think, in the community, and that's been the resistance for several years now for electronic medical records. The fear that people have that, oh no, people are going to have access to my information, or somebody's going to, you know, use something against me. And so I think we have to do something to kind of overcome that fear and just.
And I think too, just from experience, and this is probably a whole can of worms, but when you go to file for disability, it's 20-something pages, and they want every single record ever and every single doctor, and then you are told that, you know what, this is going to be turned down. This is going to be turned down, and so then you're going to have to go back and do it again. And what about the people that don't go back? What about the people that, you know, aren't told you need a disability attorney, and just give up, and you know, then they're unable to be a productive member in the community and able to give back. So what do you do there? So again, don't know what the answer is, but it goes to just that information overload and technology. How do you make it easier on people to get what they need?
It's the way the system is set up also, because it's set up that way. Automatically, half of what social workers do, at least with working with the elderly, is fill out the documentation so that they'll get rejected by Medicaid or Medicare or whoever, and then they have to go through the appeal process. A lot of times, you know, they can't do it by themselves, so the social worker is the one walking them through that whole appeal process, but they automatically know you're going to get rejected, but we have to go through the steps because this is the way the system works.
And how much wasted time and
Exactly.
effort and money, and I'm getting